This is United Medical ACO weekly event, and my name is Kemal Erkan. I'm the chairman of United Medical ACO. So now, when I was going through what you have done so far, again, one of the things that the reason we wanted to talk to you was the FMLA, paid FMLA. So now Susan Anderson is looking at me. She's right here with me. So, and then she's in charge of our operations, HR. She's our finance person as well. So every time there are changes are mandated by the government, we always look at it from the affordability standpoint. Mm-hmm. So I'm asking this question maybe on her behalf, and then we can talk about how what your plan is. Now I understand that this is just introduced in May, right? Mm-hmm. And perhaps. Kind of giving us the background of it. I read a lot. So, I mean, last night, probably more than 1.5 hours, I was watching several different videos and reading several different things related to your life and the videos that you have done. And so much there. So for people to really do what I did, they may not be able to do it. But if you can just summarize what that is for everyone so that they can understand why this is necessary and why this is so important. And what we are missing as a country that we don't have today and other countries do have.
Sure. Well, that first off, thank you so much for having me, and thank you for this public service that you're providing of these conversations and these COVID updates. I do just want to reiterate the points that you were making regarding the vaccines. I'm the chair of the Senate Health Committee, and so I am deeply committed to ensuring that Delaware reaches that herd immunity level of full vaccination, that the rest of our country achieves that the world achieves that, because we know we will all only be safe once worldwide we've reached that herd immunity. You mentioned the variants. We know that while the COVID vaccine is incredibly effective against the variants that we've seen thus far, the longer we go and without reaching herd immunity, the continued risk we face with variants that could develop that may not be as protected against by the vaccine. And so we have to get people vaccinated. It's critical. We are now above 70% of Delawareans 18 and older who've received at least one dose of the vaccine, but we have to get to that higher number of fully vaccinated Delawareans, fully vaccinated Americans, and fully vaccinated people around the world. And right now, one of the things that we do have to ensure is that we continue the public education campaign, that we continue to be creative around getting the vaccine to people where they are, breaking down any of those physical barriers to care that people face. I think, for some of us, it might seem small to take time off to go get a vaccine. But for someone who's working paycheck to paycheck, even taking that hour off to get the vaccine could be make or break for them to be able to pay their bills. So we have to continue to be creative about getting vaccines to people, breaking down those barriers, but of course, reinforcing for people that this is safe and effective and necessary for our own health and for the public's health. And that actually gets me into a lot of the motivation behind Senate Bill 1, which is the Healthy Delaware Families Act, which would provide up to 12 weeks of paid family and medical leave for Delawareans. Just to step back, I come to this legislation as someone who's been a caregiver in my life. My husband, Andrew, was diagnosed with cancer about a year into our relationship. And as two young people living together in Washington, D.C., we were each other's sources of support. And we were lucky to have employers who allowed both Andy and myself to take paid time off work for Andy to focus on the full-time job of getting potentially life-saving healthcare, and for me to focus on the full-time job of being there for him, supporting him, and caring for him. The treatment was incredibly significant and time-consuming, and for Andy, debilitating. He had to relearn how to talk, how to breathe, how to eat. After he had an incredibly invasive surgery, I had to be there to clean his tracheostomy tube, to tend to his wounds, to feed him through his feeding tube. Ultimately, Andy's cancer spread and it became terminal. But because, once again, we were lucky to have employers who provided us paid leave, we were able to take the time off for Andy to prepare for his passing, potentially get some life-enhancing palliative care, and for me to be there by his side. It also allowed us to get married before he passed away.
Now, he was a lawyer.
He was.
Right? So even for someone who is maybe in a, financially, he was probably doing better than most people. So this is not about just the financials at that point, because the care that he needs is at a really different level.
Well, absolutely. I will say he was an attorney. He wasn't practicing law. He was working at an advocacy nonprofit. And we were both living in Washington, D.C. at the time. So the savings that we had in the bank weren't as significant as potentially a practicing attorney might have. But we were lucky, right? We had that policy. And we also, in the extreme circumstance, had we not had that policy, we had family who could have supported us. But what I was about to say is, so many people aren't that lucky. So many people are living paycheck to paycheck. And most people in our country and in our state do not have access to any kind of paid leave. Federal FMLA provides up to 12 weeks of unpaid leave for several different qualifying events. But it, again, is unpaid, and it only applies to individuals who work for employers with 50 or more employees within a certain vicinity. And so there are significant holes in an already insufficient safety net. Around the world, every other industrialized nation has figured out how to provide this critical support system for people when hard times hit. Because ultimately, everyone's going to face a major life event that's going to require them to take time off work, whether that's having a child and welcoming a child into the family, whether that's a serious health condition, or whether it's a loved one with a serious health condition that you have to care for. Every other industrialized nation provides this type of benefit, except for the United States. Fortunately, though, a number of places have started to make progress, and now 9 states plus Washington, D.C. provide this type of benefit through a program very similar to what's in Senate Bill 1, the Healthy Delaware Families Act. So
now from the business standpoint, I'm a business owner, and going back to the question that Susan had earlier, now in terms of how we can make this affordable from the businesses so that it doesn't become a big burden for us, what's the, how can we make this both efficient or win-win for us? So what's the idea? Like, is it affordable? Is
yeah.
it, I was trying to kind of get into the details of it, but honestly, like just coming back from Turkey on Monday night, still trying to catch up. So if you can just tell us what businesses should be doing, what we should be expecting, because we do want to actually do more for our employees. Right. Just recently, in the last 2-3 years, we have made several different changes in our benefit packages. One of them was we made some adjustments based on our generational expectations. Like we have a lot of millennials, 65% at that time. We changed our eligibility for getting more vacation from 5 years, so we reduced it to 3 years to get more vacation. So instead of once you complete 5 years, you would get 1 week, right, Susan? So we reduced that to 3 years, so then they can actually see it, because you have younger people. They don't stay maybe for 5 years. So we try to give them certain things earlier. So we changed the short-term disability. We made it, I paid it for everyone. So because for the maternity leave, it became a problem. So then we said, well, if they're not getting the short-term disability, let's just make it standard for everyone. So I'm paying for everyone for the short-term disability. So if someone is pregnant, they can have maternity leave as long as they plan it accordingly. So right. How would this be operational from our side?
So that it's a great question. And that's one of the reasons why I'm so excited about this policy, is because I do believe it's a win-win-win. It's a win for workers, it's a win for public health, and it's a win for businesses and employers. Stepping back just for a second to sort of describe how the bill works, is it creates a statewide insurance pool that is operated by the Department of Labor. It would provide, through the Department of Labor's insurance program, wage replacement for workers while they're out on leave. So this isn't mandating that businesses just, for 12 weeks or however long the person's out up to that point, pay out their salary. The person would go off the salary of the employer and go on to the social safety net, the social insurance program operated by the state. That is funded by a very small fraction of a percentage payroll contribution split between employer and employee. That contribution is less than 1%, split between two. So that means that an employer will pay less than 1/2 of 1%, an employee would pay less than 1/2 of 1% of their wages. So for a $15 worker, that comes out for an employer to roughly the cost of a cup of coffee per week. Now, stepping into the question that you asked around, is this affordable? Is this good for business? Yes and yes. So essentially right now, we know that paid family and medical leave is an increasingly not just necessary benefit, but desired benefit. And that's one of the reasons why you are seeing more and more larger employers providing this benefit on their own dime, because in order to win the competition for talent, they have to have competitive pay and competitive benefits. And so you're seeing large corporations that have significant profits providing this benefit on their own. The problem is, for medium and smaller size employers, it becomes difficult to provide this benefit on their own. And there are essentially three ways that this benefit could be offered. One is by an employer just saying, if you take off, we're going to continue to pay you. Another is through a private insurance program. And then the final is through a statewide insurance pool. Without question, the most economical and affordable way to provide this benefit is through the statewide insurance program. By pooling everyone together, we are able to have such a small contribution to fund the program that employers and employees don't really see that contribution impacting their bottom line. And then we're able to pay out the benefit. And in the states that have done this, in places like California, New Jersey, the data is clear that businesses say, over 90% of businesses say that their paid family and medical leave insurance programs either have no impact on their bottom line or actually have a positive impact on their bottom line. Because what ends up happening is, because this benefit is now available universally, they end up being able to retain talent that otherwise leaves their place of employment because they have a major life event, because they have a kid, because they have an illness, because they have to take care of a family member. And so in states that have passed this, they actually see lower turnover, longer loyalty to their place of employment, and therefore greater productivity because of the retention of that talent and that experience, and a reduction in costs for training and a reduction of costs in new hiring. Again, 90% of businesses, over 90%, say this has no impact on their bottom line or even a positive impact. And smaller businesses are even more likely than larger businesses to report that positive impact on their bottom line, because of that retention of talent, because of that retention of experience, and therefore productivity. Similarly, because a lot of businesses, I talked to a small business owner of Brouhaha here in Delaware. We all know and love Brouhaha. She's fantastic. And she provides some level of paid leave to her employees, but she's paying it out of pocket. She loves this because it's the right thing to do, but she also loves this proposal because if passed, her employees would see an even more robust benefit, and she would pay significantly less than she is for the less robust benefit out of pocket. And so she loves this because her employees are going to benefit, but she's also going to save money. And a lot of businesses are going to see that same kind of benefit because, again, this statewide insurance pool is a much cheaper option than paying it out of pocket, paying salary out of pocket. And the other positive is that when an employee is out on leave, now a lot of let's say an employee comes to you and says, let's say you're a small business without disability insurance. An employee comes to you and says, I have cancer, I need to get treatment. Well, businesses in many cases are like families, and that business owner is going to say, you know what? I know you still need to pay your rent. I'm going to let you take time off. I'm going to continue to pay you. It's not a formal policy. Now, those employers get to retain that wage. So when your employee goes out on leave, it's the Department of Insurance paying that salary. You get to retain that salary to save it, to, if absolutely necessary, pay overtime or even hire a temporary replacement worker. But businesses get significantly more flexibility with their money now because of this state administered social insurance program.
So do you see any concerns? Do you have any concerns with the government being a little bit more involved and getting a little bit maybe bigger, and there may be a little bit more headaches? And I'm just asking this because every time we have a little bit more government, we do have a little bit more problems. And we have seen this with Medicaid in some cases. Do you see this may become a problem?
So
like these questions, we have to discuss these because
absolutely,
it sounds great, and because we want to do these. Honestly, we spend a lot of time on the HR related issues because we want to retain talent. That's extremely important. We want to be flexible, so we want to understand our family structures. We can support the families because that's part of who we are. So we don't leave our families at the door. That's still part of us. So when we come to work, if someone is dealing with, we use the example of cancer, but even it doesn't have to be that severe. But if someone has depression or someone has other issues, my company, we provide healthcare.
Yeah.
So while we are providing population health, for me to say it has to be so severe for the family member to get involved is not necessary, because we see how important it is for families to support each other. So, and I support the idea greatly. It's just like some of these, issues with the bigger government. What would happen with if there are any loopholes that may be creating some issues? Unless I don't know how much we study those. If you can maybe
so the beauty here is that we have already 9 states plus DC that have these policies. So we're able to look at them and see that these policies run smoothly. These policies are positive. These are positive policies for workers and businesses. Does any system work perfectly? Of course not. There's always going to be issues. You brought up Medicaid. Certainly there are imperfections in Medicaid, but the alternative of not having Medicaid would be even worse. You'd have significant portions.
In Delaware, we are actually extremely, I'm sorry to interrupt, but Delaware we have a very successful Medicaid program. But in Pennsylvania, it's horrible. So Pennsylvania pays 1/7 of what Delaware pays for a physical, for a physician's office visit. So it's like one of the most horrendous, hideous program ever.
Yeah, and there's certainly variation state by state when it comes to Medicaid. But ultimately, the reality with Medicaid is no matter the imperfections in the system, having Medicaid, I think most people would agree having Medicaid is better than not having Medicaid. Not that there's not improvements that can be made. Here, generally speaking, broadly speaking, what we see is that this runs smoothly and it's a positive. Again, that doesn't mean that there aren't always areas of improvement in the systems that have been created, or for that matter, in the system that we will potentially create here in Delaware. But I was talking to an HR specialist who has clients in DC, Maryland, Delaware, Pennsylvania. DC has a paid family and medical leave program. The HR specialist was singing its praises. She said it's actually simplified things for businesses because it's actually also allowed for particularly small and medium-sized businesses that don't have in-house HR departments. it's not putting the burden on them to adjudicate and determine qualifications for this program. In many ways, this is able to outsource the HR costs to the state through the social insurance program, which the payroll contribution covers that administrative costs. And so therefore, it's actually taking off burden from HR departments or from business owners who don't have HR departments when it comes to the context of this leave. And so, you know, there are already requirements around federal FMLA for larger employers. This actually would have less burden on businesses than federal FMLA in terms of the administrative process, since unlike FMLA, businesses wouldn't be forced to be the body that adjudicates and makes determinations on every single instance of a claim. And so the positive here really is that businesses will be freed up, whether it's the retention of salary, whether it's the freeing up of bandwidth for medium and large size employers, HR departments to focus on other things. So, you know, this is really very much a positive for business in practically every way. And obviously there are going to be lessons learned. There's going to be areas of improvement as we go on. But I don't think anything that we're talking about here, any area of improvement in any of the states that have passed this, or, you know, should we pass this, any of that is greater than the headache, one, facing businesses right now when they lose an employee, because that employee just has to end up leaving their job because they start a family, because they have an illness, because their family member has an illness.
You know, one of the most expensive things for the employers is losing a trained employee.
Exactly.
Most expensive thing. It's like it's extremely expensive. So
that's right. And we see 5 to 10% greater retention because of these types of policies.
Now, do you plan to make any changes on the eligibility requirements?
Yeah, so, you know, the bill has not moved. We introduced it in May, and I continue to engage in conversations with stakeholders throughout the community on the specifics of the legislation, including the Chamber of Commerce, including entities representing employers and businesses, to determine what the final piece of legislation that we push forward will look like.
So you have big support in the Senate, though, right? Like Valerie Longhurst is a big supporter of this.
Yeah, so we introduced this legislation in the Senate. I am the prime sponsor alongside our Majority Leader Brian Townsend, and in the House, Representative Deb Heffernan is the prime sponsor alongside Representative Majority Leader Val Longhurst. And beyond that, we have more than 24 co-sponsors. In the Senate, we have 13 co-sponsors, which is a supermajority in that chamber. And so I do look forward to running and passing this bill next year. But in the 6 months leading up to that, we'll continue those conversations to ensure that the final product incorporates feedback and experience even more than it already does from all the different relevant stakeholders.
How about the governor? Is he supporting it?
I'm in proactive conversations with the governor's office and his team. We've been in discussion prior to introduction, and we'll continue to have discussions. He certainly recognizes the importance of paid leave for people, and I think wants to continue to engage in these conversations over the next few weeks and months.
So if it would be helpful, and if you would like to talk to our HR department
sure.
To understand the mid-sized business issues, and if they may have some other questions, and if it's only going to help you, because I'm in full support of this, as long as we are able to understand and make it clear to our employees and our HR. So I think this is going to help for those who may need this.